What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. Today's video, we are covering why I chose X-ray tech over nursing. To give you context, I am a night shift X-ray tech. Been doing it for over 4 years at a Trauma 3 ER in the state of Texas. And me personally, I was like this close to thinking of maybe going into nursing, as many people, because nursing is like the popular one, the one everyone gets all the credit, and it's like the other modalities or the other aspects of healthcare aren't as known as much unless you're in there, like the respiratory, X-ray, physical therapy, like unless you start, I mean, now obviously we have the internet and all the other stuff, so like it's more abundant and there's more stuff like that going on. But most colleges, if you go to school, nursing is literally almost in every college. Compared to X-ray, I think in our little state, there was like maybe 2 colleges within the 10 that are close by that offered the X-ray program. So just looking at the stack, some aspects of it, they are more harder to be a nurse, and there's more, I mean, there's bigger classes, like there's larger, like I think like our school offered 50 people to get into the nursing school versus the X-ray tech program was like 20, 25 if they're pushing, like, so there's that aspect. But I know that my lady, who is a nurse, I've sat and talked with her a lot. There's a lot of aspects of school where they have it harder, and there's other aspects of school where it's harder just to do X-ray. So it is kind of a teeter-totter in that aspect. There's been people who said that the board exam is harder for X-ray versus nursing. I can't really speak much on that because when I asked my lady about it, she has a photographic memory and she's really smart, like Sheldon people. And then there's me, who's Team 75. So I can't really give you any advice on that aspect. So, but as far as like the actual schooling and stuff, like ours is there, you could start off as an X-ray tech versus LVN, which are both associates, and then you can, which there's also RN, and then there's the BSRN, which is for nursing, and then X-ray, you can just start as X-ray, and then later get your credentials for CT and all the other stuff like that. But as far as the actual job goes, I'm hands down thankful that I chose X-ray, because the stuff I see these nurses doing and the stuff my lady tells me, I'm like, F that. I have the highest respect for the nurses when I go in there to try to do my exams and they're doing something and they're like, we're gonna need a minute. I'm like, it's fine, it's cool. Let me know once you wiped his butt or did whatever you're doing, because that couldn't be me, you know. I'm thankful that most of the time we just do a little chest X-ray, a little 30-second work of patient care. If you have good equipment, if not, if you're shitty equipment, it take a little bit longer. But I'm always thankful that they do that and I do this, because there's been many times where, especially in the emergency room at the hospital, let me put it like this. Every single patient that walks into the hospital has to be seen by a doctor and a nurse, but they don't always have to be seen by X-ray. Just putting that out there. Someone has to triage them or send them in the back, and they have to be seen by a nurse. Even with charting too, the amount of charting some nurses have to do. Just seeing my lady also chart at home for her job too, or just like big on. Meanwhile, me, chest pain, short of breath, MVC, NG2. Just like tiny little things like that. That's the most charting we have to do, you know? Or patient was unable to move, unable to get optimal images. just to cover your butt. You know, stuff like simple stuff like that. Even the work, some of the, like, I've seen them do wound care. I've seen them do a bunch of other stuff. Very, very tedious. Meanwhile, us, just chest x-ray, boop. 2 view, boop, boop. 3 pictures on most of the stuff. Maybe a little bit more. So it is kind of, I am thankful that I did x-ray. But then again, there's some times where there'll be traumas and the patient is not in a trauma bed and you'll be doing a very physical, heavy stuff. Meanwhile, the nurse is like, oh, let me just give them a little drugs and good luck. There's that aspect of it too. And even medication and stuff like that. In the x-ray department, we really don't have that many. And even in certain places, you have the nurse with you dealing with the medication. Most of our medication is like barium, gastrografin, all the contrast studies like that. Even then, it's not, or lidocaine, or even lumbar punctures and stuff like that. Even then, that's not that much medication you really have to worry about. They have to know all the medications, know if something's allergic, knowing the dosage, knowing half the time in our department, if we have to pull something, the RPA is the one drawing it. We just have the little vital and they deal with it, they chart it. And it's not really that much. So even charting for ours for medication, majority, like we have a little vault of gastrographin where you literally grab it, put it in a cup. Here you go. We're not doing all the IVs and injecting and doing all these, unless you do CAT scan. But even then, the IVs, most places are already done, and you don't even have to deal with none of that. So I'm always thankful that I did X-ray because it's pretty chill. Because I've seen some of the stuff at work, and I'm like, I don't know if I could run 7 on, 7 off on nursing, because I would probably not work that much overtime and I'd be miserable. But I will say that nurses do make more money than basic x-ray. I will put that out there. But between me and my lady, she works daytime, I work nighttime, I do technically make more money than her. So, but I do know, depending on the level of nurse you are, your pay can be like $10 more, $15 more than we do, but they deal with a lot of stuff, and it's a lot of patient care, and so there's a lot of more liability aspects to nursing too. But then again, we are over here spreading cancer, shooting people up all the time. And there's that aspect of our profession that scares people, that you are within radiation, dealing with that. But even then, nurses are too. If they don't move, they're within the splash zone too, so they can get it too. But we are more of the chance of getting the daily dose of radiation and dealing with that. So there's that aspect that scares people like that. Or when they're in clinicals and they find out that we have to put stuff in people's bums, like enemas, that they were like, yo, I didn't know how to do that. I thought we were just doing x-rays. That could scare people off for the x-ray world. Unless you do night shift, and we just mainly just do the chest x-rays. At least at my place, trauma 3. The most like that I have to do as far as fluoroscopy is like maybe a little bit of gastrographin for like when we change out the G-tubes and stuff like that, and it's really not that bad. Versus the nursing doing all the other, assisting with all the other procedures like, thoracentesis, chest tube, or whatever other stuff they have going on over there. There's a lot more. Well, thoracentesis, we deal with that. That's more interventional radiology, but if you're debating whether you want to be a nurse and you want to be an Xray tech, you can check out my channel. I literally have other videos of other aspects of this profession, and you can make your best decision. Because I will say, if you're like Miguel, I really want to feel fulfilled, that I help people, and I love patient care, and I love all that, getting all the credit and go be a nurse. But if you just want to help people, but from afar, from 6 feet, do X-ray. Because I would say that you have to have a lot more patience and a lot more charismatic, caring, like to be a nurse versus X-ray. I would say at this point in my career, I've become corrupt. Still have sympathy and stuff like that for people and all that, but it's nothing like the nurses do, because like my lady will tell me something and in my brain I'm like, and then my lady will be telling me with such passion and such like I know she cares and loves this, and I'm over here like I'm just here for my chest X-ray. I don't really get too deep into it. So if you're in the fence, there's a bunch of videos, because I will say, if you're in the fence about it, there was one time in school where there was this one dude who literally went to become a nurse, got the credentials of my lady, and then went to work for like a few months and then said, nah, it's not for me, and then jumped over to X-ray and now is double certified. So I will say that there are more jobs for nurses. Like even the ratio at work is like 2 X-ray techs overnight, and then there's like 100 nurses. So there's, depending on where you live and how small your hospital is, there could be less slots and less places you can work as X-ray tech. So I could see that being a reason why you would choose nursing. The nursing do get all the credit. We're more just like, they just push the button, which we do. I love pushing the button. It's the fun part of the job, spreading the daily dose of radiation. So if you're on the fence, you can check out my channel. I cover different aspects, and we'll see you on the next one.